I started with a small company called Faring, which is still around. And then slowly from there, I worked through clinical. I've done, some work in government affairs, health economics, and then I made my way over to the commercial side, or the dark side, as those of us call who have been on the medical division. And I worked my way through GP sales, specialty sales, marketing, sales management, and then to business unit head. And I've had some great opportunities within this industry. I'm very grateful. And I think really in terms of, influence, I would have to say my father, really my father. My parents are immigrants, so I'm a first-generation Canadian. And all I heard growing up is, we came here to give you a better life, to give you an education, so that, as my mother would say, put your mind to it and you can do whatever it is that you want to do. And I think that that's really, where I learned that it's up to me. My dad is 78 years old and he still works full time. So that's the kind of influence that I had on me. So.
Great. Eileen?
Good morning, everyone. I'm Eileen McCormack. I work currently at AstraZeneca Canada. I look after new product development. So we start looking at products when they're still numbers. And this is fantastic work. I work with a really talented group of people, very lucky to have them working with me. And I also work in the business development area. Did I always think I would come to healthcare? Actually, I have a story about my mother as well. It just shows how our parents are probably the biggest influence on us throughout our lives. I did a university degree at Guelph in biochemistry, and then I also did a graduate degree in biochemistry. And after all of that, like many mid-20-year-old people, I started running out of money. And so I decided I needed to get a real job, and I had a contact. I only actually had to send one letter, and but that was luck. And I was very fortunate to have that contact. And so I started off in sales, and my mother said to me, and I still recall her words, that after numerous years in university, probably about 7, that I was going to be working in sales. And I think my mother also had wanted me to be a physician. And so that was a big disappointment to her. But looking back, I think she's okay with it now. We get to do fantastic things in this industry. The doors are wide open if you lean in. Let's start with that. And so I have had numerous opportunities, starting off in that sales position, sales training, sales management. Then I moved into marketing, and I moved my family around a little bit while we were progressing this career. Moved from the Toronto area to Ottawa for 6 years, and then moved here to Toronto to work in a marketing position. And then I had a fantastic opportunity to work in the US in a global marketing position for about 3 years, which was really I would have loved to. I would love to be able to explain all the fantastic things that happened when I was there. Robin Lawrence is here today, and many of you would know him. And he and I worked down there together. It was an opportunity of a lifetime for my career and also for my family. And then we came back here to Canada, and I'm in the position that, generally in the same position that I have been in since we returned. Very fortunate to be in the industry and happy to be working in healthcare. I think when I look back, I think that along the lines of what Lee has already said, I think we have, I do feel that the work that we do in pharma makes a difference. We often meet physicians and patients and stakeholders who, while working with them, we can see that the products that we bring do make a difference in patients' lives. So I'm happy about that, and I'm proud to be working in this industry.
Great, thank you. Nancy?
I'm Nancy Krunich. As Dorothy said, I head up the molecular diagnostic unit of Luminex, and more specifically the Canadian division. Luminex's business model is one where we have two main areas of focus. One is our technology and partnership business, which was built on a licensing model where the technology used for diagnostic testing as well as other both